All right. Hey, everybody. How are we doing today? It's great to finally be back. For those of you who've been following us on Nobody Studios, I know that you have probably been absolutely overwhelmed with the amount of content we've been pouring out, interviews we've been doing, updates we've been sending out. We've had a lot of momentum over the last 60 days, and it's been a pretty wild ride for us. It's been exciting. It's been amazing to see people who are investors in the studio now, who are excited about bringing their ideas to life, bringing some of their skill sets, their knowledge, their previous experiences to help us build what we want to build. It's been amazing to just hear from people who've been following our journey for a while and are finally seeing all of this hard work continuously not only paying off, but becoming open and apparent to the public. Behind the scenes, things have just been an absolute whirlwind and roller coaster of fun and excitement and emotions and hard work. And I don't think that that's going away anytime soon, even after the raise, even after we get companies off the ground. But what's really, truly exciting about this is the fact that we're building something that no one else has built before. And at Nobody's Studios, we truly believe that the best companies have yet to be created, which is why I'm here today talking about healthcare and medicine and integrative aspects of how we can actually not only just build companies, but build companies that help people. And this is one of the main things that attracted me to the journey in the earliest of stages was the fact that I wanted to be a part of something not only far bigger than myself, but I wanted to build things that are going to continuously help people even when I'm not around. One of the earliest lessons that I learned in clinical practice was that I can only help so many people in the practice, in the office when I'm there doing my hours. I can't help people when I'm not practicing. And so I had to look at that and look at myself in the mirror and say, well, what else is there? What other aspects and avenues are there for me to help people when I'm not seeing patients? And it was in building companies. It was in taking my knowledge and experience and the problems that patients told me about, that fellow colleagues told me about, and taking that and saying, well, what can we do about it? Well, we can build companies, we can solve problems. It's the same thing that I was doing in medicine originally. And now I get to do it with people who are far smarter than me and have far more credentials than I do to be able to bring these things to life. And it's been a wild ride and an absolute journey. But more importantly, too, it's been enlightening. And the growth that's happened and the changes that have happened have been nothing short of amazing. So I'm super grateful to be talking today about one of the initiatives that we're really, streamlining ahead with Nobody Studios, and that is looking into healthcare. That's looking into building companies that are going to help people. And precision medicine, really, in my opinion, is the future of healthcare. And this is why precision medicine is essentially an individualized approach to healthcare. Now, it's also known as personalized medicine, individualized medicine. They're all interchangeable, but at the end of the day, the concept doesn't change. It's about understanding you genetically, it's about understanding your environment, it's about understanding your lifestyle, your perspectives, and really even your surroundings. I mean, your social relationships have a massive impact on your quality of life. And this is something that I would say to a point has been overlooked in previous decades of medicine is that, we've been all about understanding your genetics, understanding your epigenetic makeup, understanding nutrition and diet and exercise and sleep. And while those are really impactful, some of the longest studies on longevity have actually shown that it's your social relationships, it's the connections that you have that are actually really significant predictors of your quality of life. The goal of what we're trying to do with targeted and precise medicine is to really create tailored solutions to every individual out there. And this is what makes us unique. This is what makes us, is that even if you have family members, your genetics differ in some way, shape, or form than your siblings, than your parents, than your children's. And that's a good thing. That's why we evolve. And so this approach of precision medicine takes into consideration your genetics, but it also takes into consideration other aspects of your physiology. So if we're looking at the genetic makeup of who you are as an individual, we can't change that. We can't manipulate or predict, specific aspects from your genetics. Although we know a lot of things about genetics, unless you're using CRISPR technologies, you're not going to change those. But what's amazing about your genetics is that there are components that you can choose to express or not. and this is true with even BRCA cancer genes, is that there might be siblings who have BRCA cancer genes, but why does it get expressed in one person versus the other? Well, it's because there are a lot of other factors that control our genetic makeup and our genetic expression. And those are really the epigenetic factors. So the above the genome, the epigenetic factors are really important aspects. And this is really where precision medicine gets really exciting, is that while we can't change our blueprint, our genetic makeup, what we can change is our diet, our lifestyle, our sleep, our exercise, all the individualized aspects of what can actually make notable changes in our quality of life. And this is what excites me about precision medicine, is that it does take into consideration your environment, your lifestyle, because we need to understand these mechanisms because they're going to allow us to make more efficacious decisions on what's going to work for you and what isn't going to work for you. That's why precision medicine to me isn't really a new concept, but it's a new way to think about how we move forward in the future. And more importantly too, it's a disruptor in the industry because if you're a hammer, you're looking for a nail. If you're this type of provider, most of the time you're going to move to this modality, this therapy, or this intervention. And in some situations, that's not necessarily wrong, but is it the right choice for the patient? Precision medicine kind of washes all that over and says, hold up, let's figure out what this person actually truly genuinely needs, what they're going to respond to, and then let's try that. Let's give it to them. It allows us to be more precise with treatment programs, right? Helping us improve therapeutics, maximize patient outcomes, and overall reduce healthcare costs because that is a massive burden. You're going to see in a couple next slides. In the United States alone, $765 billion a year, that's billion with a B, is spent on unnecessary medical therapies that don't yield beneficial outcomes. That's scary. So honestly, what if your providers knew what medications you would and you wouldn't respond to? Do you think that that would help your clinical outcomes? What if they knew the best course of action for therapy or surgery? What if you had a low back issue and all of a sudden you go see a surgeon and they're like, well, we need to do surgery right away. Well, what if your physical therapist thought something different? What if your chiro thought something different? What if your massage therapist thought something completely different? And what if a physiotherapist came in and said, you guys are all wrong? What if we knew from the beginning how we could respond in an orderly fashion? Almost like when we have fire escape plans and we know exactly which exits to take. What if we had that path mapped out for us? We believe that precision medicine will actually be able to do that. Because what if you knew your response rates for a procedure? And what if we could actually dial in the best therapies for you? Well, I think we can. And we really do think we can because here's the scary part about all of this. Our global health statistics in 2023 are startling. Cardiovascular disease is still the world's leading cause of death. I mean, 1 in 3 people worldwide are dying essentially from cardiovascular disease, which for the most part, outside of genetic predispositions, are preventable, if not treatable in some way, shape, or form by diet, lifestyle, right? Understanding your environment, things along those lines. One of the scariest stats is how much money we're spending on healthcare. And this is essentially really rampant and really true, especially in the United States. But global spending on healthcare more than doubled between 2000 and 2019. It's at an average of 9.8 of the global GDP at this point in time. And sadly, those statistics are set to get worse. 13% of our global population is clinically obese, and that number is crawling up and up and up every single year. It's not a genetic problem because in the 30s, 40s, and 50s, we didn't have this rate of obesity, and our genome doesn't change that quickly. So while we need to understand the genetic makeup of who we are and what we're dealing with, it's really the environmental factors, these epigenetic factors, that are really going to dictate which genes we turn on and off. Because the problem is that we're living longer, but we're also living longer with disease. If the last 10, 15, 20 years of your life are extended, are they extended for your benefit? Are they extended for more suffering, more pain, more financial burden, living in a home, not being able to take care of yourself? Are these the outcomes that you want? Well, absolutely not. Yet unfortunately, here we are. And here's an even scarier statistic is that I was speaking to a colleague of mine the other day, and he was telling me that $1 in 5 in the United States Medicare scheme is now currently being spent on Alzheimer's, a condition with no known cure, no known pharmaceutical that can actually make notable changes in symptoms, and something that is exponentially growing year over year over year. $1 in 5. That's expected to go to be 3 to 4 or out of $5 over the next decade or two. We clearly have a problem. And this is one of the core theories that we carry at Nobody Studios is that patients need to own their health and they're ready to take their health into their own hands. We truly believe that individualized medicine is the future. And it's not because we want it to be, it's because we really feel it has to be. If things were working as well as they should be at this point in time, we would see a reverse in trend of nearly every single chronic condition that we're describing and talking about. But we don't. And people are getting fed up with the system. And it's not that doctors aren't getting fed up with it either, or that insurance companies aren't getting fed up with it either. It's just there are so many complexities to the system. And one of the core theses that we have at Nobody Studios is that some of the best companies have yet to be created. If you're old enough to remember a titan in the industry, a company called Kodak used to be a titan in the photography industry. Well, where are they today? Well, they weren't able to evolve and adapt. And there was probably an acquisition at some point in their past, but they're the same thing as the conversation between Blockbuster and Netflix. If you don't decide to evolve and take problems head on and try and solve and be innovative, then we're not going to be any better off than the previous people that came before us. Because here's the deal. If we don't evolve, nothing's going to change. What we believe at Nobody Studios is not only is precision medicine the future of healthcare and medicine, but wearable technologies play a significant role in that. My wedding ring is an Aura ring, and outside of it tracking my heart rate variability, my pulse ox, my sleep patterns, it gives me feedback and tells me, hey, what did you do last night? Is there something you can modify today? Can you improve something in your metrics to get better outcomes? This is exactly what we're looking for. Because unfortunately, as a society, and I'll extrapolate this globally, but especially in the United States, we really are broken mentally, physically, and emotionally. Now, the United States as a whole is probably the number one country in the world for providing emergency care services. So if you have a heart attack, if you have a stroke, you have a traumatic brain injury, something that comes along that really takes you out of your game, you're in the best you're in the best country in the world to be able to handle that. But the problem in lies is that a majority of the problems that we're dealing with are chronic conditions that manifest as chronic conditions for days, weeks, months, years, and decades. And then at some point in time, they present as acute problems, aka the strokes, the heart attacks, right? The big problems that we, know in some way, shape, or form have some sort of aspect of prevention in front of them. But this is where we're really failing in the acute care space is that chronic diseases, on average, are costing us $765 billion a year. Not only in that, these are unnecessary treatments and opportunities for care where patients are no longer getting the services that they need or deserve. And by the time they're presenting in the hospitals or the clinics, these are things that are 10, 20, 30 years in the making. Well, what do we do at that point? Well, we become reactive. We try different aspects and we do the best we can, but it's time to change that. It's time to get people to understand that their decisions really matter. Because chronic diseases are responsible for nearly 70% of the deaths in the States. And from a standpoint of developed nations, we'll say, that statistic probably reigns true for most of them. But even scarier is the silent epidemics that are occurring. Global mental health costs are going to reach $16 trillion by 2030. This is affecting nearly 1 in 7 or 1 in 8 people worldwide, up to 1 billion people at this point. Now, if we were making the changes that we were hoping to make, we would see these things declining, but they're not. Because there's one size fits all mentality that we carry in medicine right now is really killing us. And even though we say that we need people individually, unfortunately what happens is that they get caught in the system. We try specific modalities, specific surgery, specific therapy. We say, well, that didn't work for you. Well, maybe it's your fault as the patient, but it's not. Maybe we need to think differently about this whole system. Here's the thing, 70 to 90% of all diseases can be attributed to lifestyle choices in some way, shape, or form. The last estimates that I understood was that disease as a whole can be attributed to about 5 or 10% from a genetic standpoint. Everything else on top of that is essentially the way that we live, the way that we eat, the way that we communicate, the way that we have conversations, the way that we live with each other, and the way we interpret our world. Almost half the United States population is taking a medication that's described to be management of symptoms where there is no cure. Now, that doesn't mean that that's wrong, but what it means is maybe there's an opportunity for us to improve these outcomes. Because if everything was working as well as it should be, we shouldn't be in the situation we are today. At Nobody Studios, we truly feel that this entire industry is open for innovation. And like I said, wearable and objective technology is number one on our list. A lot of the technology that's on the market today helps you track what happened yesterday or last night, but it doesn't always give you feed forward mechanisms or algorithms to tell you what you should change tonight, what you should improve, what you should modify. I was just having a great conversation with a great colleague of mine, Raj Kohli. Raj is a brilliant medical doctor. And Raj and I go back and forth about how we're so reactive and we're so uneducated with being able to help people not only help themselves, but change their habits. You know, if our understanding of how to help people change their habits was appropriate, or we were implementing it correctly, we'd see people modifying and adapting. But the problem is the same as with most disease, and we'll take obesity for instance. If it was just about telling people what to do, then the scale should have changed everything about obesity. And if that didn't change it, then the mirror should have changed everything about obesity. But it hasn't, because it hasn't instilled change. It hasn't instilled the change in habits, change in beliefs, change in values for a lot of these populations. And I'm not saying that it's just as easy as having a decision. But what I'm saying is that there might be other options out there on the table for us. We have to help people make those changes and help them understand why they're having these outcomes. And this is where it gets really interesting looking at even like longevity and biohacking, is that a lot of the research being done at David Sinclair's research location at Harvard and also in Australia, what they're looking at is looking at disease or longevity or aging as an actual disease. What does that mean? Well, we treat diseases. We try and cure diseases, right? We eradicated Ebola at some point. Well, could we eradicate aging? Well, I don't think it's going to be that easy, but understanding these different pathways, dealing with sirtuins, AMPK, mTOR, they're playing around with these various components within the mitochondria. And what they're finding is that there are some pretty notable improvements and changes that they can make in lab rats and mice. Well, we use those models for humans. And so some of the early trials coming out are pretty enlightening and pretty stimulating. We're not fully there yet, but could we actually make a dent in that? We believe so. We also believe that software is one of the most capable things to allow healthcare to expand and scale. And this is why we're really interested in using like SaaS-based products, different components that are going to integrate software with user interfaces to help doctors and patients make better clinical decisions. Even getting into like insurance reimbursement models. What if there are ways to just check your insurance record before you even had a surgery, before you had a procedure? You don't go to the grocery store and figure out what the total is by the end of when you go buy your groceries. Why do we do that in healthcare? It's more complex than that, but we believe that there are options to improve that system. Because with individualized medicine comes individualized nutrition, individualized sleep, individualized psychological therapies. Everything can be tailored to the individual once we start learning and getting information and feedback. Not only with that too, what if your med devices were tailored to you? 3D printing. One of my close friends is in the 3D printing business. HP is creating an amazing 3D model where they're allowing people to take a mold of their foot of their orthotic and be able to 3D print that. What an amazing technology! What an amazing opportunity! What if you do the same thing if you're having low back pain or shoulder issues? To create a sling or to create some sort of modality to be able to help you improve your quality of movement, quality of life. We also believe too that there's a reason you sleep a 30-hour day. Understanding your sleep, understanding your dreams, understanding why this amazing mechanism has been ingrained in us for centuries, for millennia. Understanding sleep is a vital component to understanding our quality of life. And lo and behold, there's no psychological condition that we know of that doesn't have sleep changes associated with it. Well, that's a really important factor for us. How many of us sleep well? Statistically speaking, not that many. Not only that, getting further into mental health, I mean, there are so many opportunities on the horizon that are changing the way we actually view the brain and mental health. And it's not just medications, it's looking at different medicines, different molecules, plant-based medicines, understanding how these things affect our genetics, our epigenetics, and our neurological systems, structurally, neurologically, even metabolically too. There are a lot of opportunities that we're looking in this space. And for those of you who follow along in a lot of this research, it's pretty exciting. We're also really interested in looking at how artificial intelligence is going to play a role with helping us help people. Now, not only from building a business in front of that, but how do we help doctors make better decisions? Well, one of the first companies that we've had our eyes on for a long time is a company called Webdelix. And this is a company that we built from the ground up Took us 9 months from ideation to launch. And I'm so proud of this team who has taken this company and taken it from an idea to literally an actual organization. What we're really keen on is making sure people are educated. One of the biggest frustrations that I struggled with when I was in practice was that most patients came to my office not even having the baseline knowledge to even formulate the questions to get the answers that they were looking for. And I spent so much time trying to educate them. And as I did, they got it. They could ask the questions, they could challenge me, they could go to their other providers and say, listen, I want to know if this is the best choice for me. The same thing has to happen with evolving medicines and in the evolving care of what we're looking at within mental health. And this is what we're really keen on and focusing on in the plant medicine space is there's a lot of research coming out about this space. Some good, some not so good, but it needs to be communicated in a way where people understand it. And since the average person in the United States reads and comprehends at a 7th or 8th grade level, we have to bring that information to them in that same format. Now, I love reading the double-blind placebo-controlled studies, but that doesn't mean everybody else does. So with WebDelix, what we're really designing to do is this is a plant medicine education platform. We have an amazing advisory board of industry experts who are far smarter about all of this stuff than we could ever imagine. And we're producing expert-produced, edited, and vetted content. And this information is already available to most people on the web. We're in our alpha phase. And what we're trying to do is we're trying to communicate effectively what's actually going on in this industry. But this isn't the only company that we're focused on. We're also keenly aware that mental health is a multifaceted, multifactorial component. And so helping people help themselves is really important for us. But what if we could predict when somebody was actually getting close to hitting their rock bottom? What if we could see some of the physiological signs of chronic stress playing a role with how it affects their sleep, it affects their mood, their activity, their outcomes, and we're able to rehabilitate them in some way, shape, or form to get them to go away from that trend? We believe we can, and this is one of the concepts that we're utilizing with Prehab Life, is that what if we could help people help themselves? What if we could help people understand that they're trending in a way that might be harmful for them long term? This is an exciting company that I'm really looking forward to trying to see what we can do with it because there's so much integration with all the other companies that we're working on as well. Because as we look at the mental health side of things, we're also keenly aware of the sleep components. And Sleep Glide is another company that I'm really excited about as well too, because we partnered with one of the world leading experts in sleep, Dr. Gina Poe. Dr. Gina Poe runs the UCLA Post Sleep and Dreams Lab. And for those of you who follow Andrew Huberman's podcast, Gina was just on that podcast earlier this week. And she did a phenomenal job of describing and understanding not only sleep, but what we can do to improve our sleep. Why do we sleep poorly at times? And more importantly, too, is sleep in our control? Well, a lot of the trackers and a lot of the wearables out there today track your sleep. But do they give you accurate, up-to-date, individualized information about how to optimize your sleep? They don't. And this needs to change. And this is something that we're keenly focused on is how do we help people understand what works for them, how to improve their quality of sleep, and more importantly, too, get a good night's rest to optimize the better half of their day. Really excited about all of these companies because at Nobody Studios, this is essentially what we do. For those of you who are unaware of what we do at Nobody Studios is a venture studio. And what that means is that we are a startup that essentially creates startups. And we have the wild, audacious goal of creating 100 companies in 5 years. And I know while that sounds crazy, here's the thing, we believe we can do it. And every single person who's joined us on this journey also believes that we can do it too. So why the venture studio model? Well, to be fair, this actually isn't a new model. The first venture studio was started back in 1996 with Idea Lab. But a lot of notable companies today have actually started off as venture studio enterprises, venture studio startups, and have made their way to mainstream media. So take a look. Here's some examples. Snowflake, Giphy, Dollar Shave Club, Hims, even Bitly. All of these organizations in some way, shape, or form started with the venture studio model. So what does that mean? What does a venture studio model actually look like? Well, at Nobody Studios, what we do is we attract founders, co-founders, industry experts, and even existing platforms to bring them internally into the studio so we can surround them with all of the tech, all the information, all the mentors, all the marketing, all the branding, all the things that they need to be able to build their company. Our goal is to allow the founders and co-founders to do what they do best, which is to lead their organization and serve their customers. One of the hardest parts about being a founder or co-founder of a startup is spending time doing things that you don't really want to focus on that's taken away from your actual business. Building your marketing campaigns, especially taking outside funds and doing external raises. These are things that take away a ton of bandwidth and that really slow down the organization as it starts building momentum. As a studio, our goal is to focus on being able to help people alleviate those burdens, to help them have those resources from the beginning, to dig the well before they need it, in order for them to understand that they're getting support from all aspects so they can focus on building the business and being in the business at some point. This is really an important aspect too, because speed matters in the industry. Speed matters, especially in the startup space and healthcare. Now, taking a little note from the GSSN white paper, this is essentially a white paper that was put on by GSSN, which is a global organization focused on the startup studio method. And what they found is that startup studios, on average, bring their organizations to both seed and Series A rounds twice as fast as traditional venture models out there. Now, that's on average, right? Companies need to prove and show that they're actually, taking action, and actions will always speak louder than words. But we're quite optimistic about this because Idea Lab has taken more than 5,000 ideas and turned them into 150 companies, which have led to 50 IPOs and acquisitions. Pretty notable number, considering this was started in 1996. I mean, that's less than 30 years ago. What's really interesting, what's really exciting for us is in 2022, out of the 550 global venture studios, we were ranked in the top 10 list. And we were one of the youngest venture studios to be ranked in that top 10 list. So we got excited. And here's the thing, you should be excited too. There's so many opportunities and ways to be involved with our studio. And number one is just by having talent, by coming in and bringing your skill set, by coming in and talking about, finding what you want to do and what you don't want to do. It's amazing to think about how many opportunities we have, not only within the studio, but within our network of the studio. If you're somebody who wants to bring in your influence, your connections, your individuals that you've built relationships with, we're looking to be a global company, and we already are a global company. I'm shooting this from London. Mark, our CEO, is in California. Barry, our chief incubation officer, just had an amazing event in Manila last night. We're already a worldwide global organization. Now, what's been fun about that is meeting people from all over the world. It's been an interesting opportunity for us as well, too, to figure out how well we really are working together, because having calls spread throughout all time zones throughout the world has definitely put an interesting challenge on us. But we've grown and we've scaled because of it. And with that, too, we've taken in global capital. We've been so fortunate to have amazing investors from all throughout the world. And almost like 40% of our capital and our investment into our angel round has actually come from international investors. This has been an amazing vehicle for people internationally to get involved in, because there's not many opportunities out there. And this is one of the reasons why we're doing a crowdfunding round right now, is that traditionally speaking, most people are eliminated from getting into the VC model for the lack of funds and for the lack of network that they have. But through the crowdfunding round that we're building, the minimum investment is $100. But on top of that, too, you have equity in the company. You have equity in the studio, which means you have equity in every company we ever get our hands on. It's an exciting time to be looking into this model because no one else is really doing it this way. And for me, what I'm excited about is I'm excited to build a world-class medical advisory board. People from all walks of life, all parts of the earth, who are coming together to solve some of the world's biggest problems. In some way, shape, or form, they all believe in one thing, that the best companies really have yet to be created, and that we can create them together. Because the best ideas don't just come from Silicon Valley. They come from all over the world. It's just demystifying that process and believing that you have what it takes and you have an idea that's actually viable in the world. Because to be fair, you're in really good company. I mean, we're so grateful to have the investors and the individuals who are part of our journey already. And I can just list some of them off. I mean, people from companies like Amazon, Allianz, AMD, American Airlines, Facebook, Google, HSBC, Skype, Stripe, Twilio, and even Volkswagen. Talk about a tongue twister. I mean, we have an amazing group of investors who have brought their talent, their capital, and their influence. But more importantly, too, a lot of our investors have also turned into people who've brought their ideas. They've brought their passions. They've brought their networks, because they want to be a part of the disruption vehicle as well, too. And most of the investors that we have are also looking to get their hands dirty because they want to innovate. They want to solve problems, just like what they started doing in industry. What's been fun about this is being on the sidelines and being involved in these discussions to say, these people are no different than us. They might have more experience, they might have more capital, but they're still hungry. They're still excited. And that's really kind of the bloodline of what we're doing within Nobody Studios. Is we're building something new. And I'm so excited to be a part of this team. I'm so excited to be a part of this journey. And it's been nothing short of amazing. So for those of you who are interested in joining us with Nobody Studios, well, what's the way to do that? Reach out, have a conversation with us. I know that my fellow nobodies are on this call today. Talk to them, ask us questions, join our investor roundtables, join our talent roundtables. Reach out to us and ask us the questions to get the answers that you're actually looking for. I want to thank everybody for joining me today because I hope you're able to learn something and understand what we're really focused on at Nobody Studios. I know we are grateful for you, and you're going to see far more of us moving into the future. So we hope to join you in some way, shape, or form. Thanks for listening today.